welcome Vicky. Can I also welcome our new non-executive directors, Caroline Wallerton, just to avoid confusion. She's a Carrie, I'm a Caroline. And we've also got Andy Brown with us as well, who's our latest recruit to the board. So welcome to both of you. I haven't got any other, I think everybody else is here. That's great. No other apologies. So declarations of interest. Anything that anybody would like to flag that is going to be a conflict of interest on the agenda? No. Please make sure you let the board support unit know of any updates to them so we can keep that up to date. Minutes of the public trust meeting held on the 25th of March. I've sent into Laura a couple of minor typos. Are there any other corrections that board members would like to make? No? Okay, thank you very much. Are you happy to approve these minutes? Thank you very much. We go then on to matters arising from the minutes and the action log and work plan. Are there any matters arising that aren't already on the agenda? No? Okay. I think just one for me on the action was under action 30/26. It said chair's report unplanned, undertake planned visit to Town End Court. I think actually in the minutes you'll find it was Phil. You were already scheduled to do
I'm going on the 14th of July, Caroline.
Town End Court. So I think we should just make that as accurate as possible that that's happening. Thank you very much. If there is nothing else, then we will go on to item number 6, my report. As I said, we have Andy and Carrie with us today. We've had some really well-attended Council of Governors events since the last board meeting. And thank you to staff who've helped to present at some of those events we've had. It's been very well appreciated. We had a really good session, a governor briefing on the Council of Governors effectiveness review as well, which was really engaging, and lots of comments and helpful comments in regard to that as well. Obviously in the report since we last met, we have a new, as has been cited in Michelle's report as well, a new Secretary of State, James Murray. He should know about finances in the NHS and budgets, since he would have had to clear it as Chief Secretary to the Treasury from the department, as well as other spending departments. So that's helpful as well. Any comments on my report or questions? Anything to add, please note. Oh, Phil.
Just at some point, a bit more background information about Whitby Hospital when it's appropriate would be helpful, because I'm sure it sounds like a brilliant opportunity, but I just don't know. So it would be really helpful to find something more about that.
Yeah, I mean, there is some more information, obviously, in part 2 of today's meeting, but it's been very positive. Our wish is to maximise the use of Whitby. And our discussions with Alison Hume were very constructive and helpful as well. And I don't know if you want to add anything more to that, Michelle. It always comes under your report as well. But while we're on it, why don't you just say something more that we're able to?
No, I think we'll pick it up in part 2, I think, if that's okay, Chair. Yes, we are looking to continue to work and try and develop the Whitby site. The MPs and the councillors and also the GPs and the clinicians have been very supportive. So we have got plans in hand in relationship to that, maybe possibly trying to get it into a neighbourhood centre. But we can pick up some of the technicalities of that, which are commercially sensitive in part 2, Chair.
Brilliant, great. Please, everybody, note that we've done a change to the timings of Council of Governors meetings. So they'll start in the morning. We were straddling sort of between morning and afternoon, which I think wasn't really very productive, certainly for participation and use of the day. So please make sure your diary is adjusted to reflect that. Okay, thank you very much. We move on to Chief Exec's report. Michelle.
Yeah, good morning, everybody. Welcome. Thank you for that, and people that are listening. obviously, I'm taking it as read that you've read my report. I won't spend too much long going through it. We'll wait for questions because there is a lot on the agenda. Just suffice to say, it's an exceptionally busy time of year. I mean, it always is this time of year, but I think given the changes that are taking place, make it even more challenging than it usually is. There are several policies there to approve, which are there for ratification, which I'll leave you to have a look at, and any questions. We mentioned health inequalities and population health a lot, but I'm really pleased to say, and it is in my report, that East Riding breastfeeding team and health visitors not to 19 service were re-accredited for their gold UNICEF breastfeeding award, and that's really important, and it's the 7th year now, and just looking at some of the data and the figures, it is exceptionally great. We know that Hull got it for the first time, but to maintain it, and the level of standard is really, really high. In fact, there's not many organisations that are saying that level, and that's about working in partnership as well, and we know that the best start in life is really important for our young babies. And lots of personnel changes happening. I've tried to capture them all, but it's a moving feast as we speak. But hopefully they're there, from the ICB board to the regional changes to the national changes as well. And as the chair's alluded to, the new Secretary of State. There was a brief meeting last week about that, and it looks like the same policy will be consistent, but they don't expect it to be much changes with that change in leadership over the next few months, if not a bit longer than that. There's lots of things in the paper around the work that's happening in both primary and community care, and they're covered in the mental health community. They're covered in the paper. Mental health is going to be exceptionally busy this next year, and I think it's great because it is getting a focus. For example, we've got the Modern Service Framework, which I've alluded to in the paper. We have submitted several care pathways and several pieces of work into that review and ongoing work, and Lynn is our SRO for that. I thank Lynn and the team for the work on that, and there's been extensive surveys to complete, etc. In relationship to that piece of work. So, and I've been asked by the Alliance to do some work as well. So I think between us, but Lynn is our SRO, that would be really helpful, that would be really influential. The next thing is the mental health strategy as well. That is something that's just come out, that they're asking for both public and lived experience and professionals' experiences, but also input. So we're collecting that, and a lot of that will really link into the work we've submitted for the Modern Service Framework. So we're developing that at the moment, and speaking to Nick Broughton, the programme director, that's going to be quite a quick turnaround. And then in the King's Speech, I'm sure we all heard the mention of the modernisation bill. Again, I've tried to cover that off in the paper with a bit of an outline of it. So basically, structural changes, as we know, the amalgamation of the Department of Health and Social Care into NHS England, the reduction in headcount from both NHS England and ICBs, and the ICB reset, which I think will be really interesting, around that strategic commissioner, neighbourhood influencer, developer. Patient voice, because it does mention the abolition of Health Watch. So what we all have to do is to really inform the ICBs how we engage with patient voice. And because of the amount of work that we do, we are deemed to be a national exemplar site for patient and service user experience. We're helping the ICB on that one. But also the modernisation bill will increase ministerial influence over the NHS. And obviously there's things like FT reshape, Foundation Trust reshape, accelerated Foundation Trust, and the role of governors. So lots of things to go through the House. There will be some challenge, we think, mainly about the single patient record, but I have covered, hopefully, it off, and we'll keep you posted as it goes. Key things in the other report: industrial action passed, thanks to Lynn again and the team, without undue incident. We'll wait and see what happens. We missed the Maybank holiday, which was great. That carried on as normal. We are thinking about winter. It is hot outside. We always think about it when it's 90 degrees outside. There's a good piece of work on transforming CAMHS. great to celebrate Nurses Day on the 12th of May. And I thank Sarah for all the work and the team on that. It was great being a nurse, I would say that one time, but it was still fantastic. And we also included our other allied health professions and other professionals as well. Just to reassure the board, the Band 5 evaluation is being taken forward, which we've already picked up on. We'll continue to develop our sickness work. That is showing a little bit of an improvement in the data. Great updates on cyber update and safety, because we talk about the digital tender a lot, and lots of the charity and the communications piece with lots of visual charts in the report. I want to thank the charity. We had a great golf day last week, and that's a real bit was about Malton. One to describe and to showcase our services at Malton, but also to raise money for the ward at Malton. And the team came and was very supportive, etc. And we raised over 7,500. So that's a great amount of money for one day. So so thanks everybody for that. And obviously lots of things planned. I will throw a shout out to the board. It is my challenge coming up. We'll put the date in the chat box. Laura, if you could do that, that'd be fantastic. And the board are welcome to come and join me and participate in my challenges, which are going to be set by staff. And they can also include the forfeits as well if I don't still get them. So more hands make light work. So that'll be great. I'll stop there, Claire, and I will pass over to Lynn just to give you a bit of an update on operational and then ask any questions that people may have. Thank you.
Thanks, Michelle. Lynn?
Yeah, so hopefully you can see from my report, I know it is very strange to talk about winter at this particular point in our very warm weather right now, but obviously we reached the end of our current winter plan at the end of March. There's a lot of work that's been taking place both internally within the trust and across the ICB to review how those plans withstood the pressures during the past winter as well. There's a little bit in there about the ICB findings, sort of the positives and some of the challenges around last winter, and obviously we'll take those recommendations forward in our planning as well. Our operational pressures, as the report describes, have been at that sort of moderate OPAL level 2 to 3 position as well. So working hard on that, working hard on our out of area mental health placements as well. They have been reducing around adults, which is great, but we do have those plans for older adults and PICU. We are watching that industrial action piece very closely. We understand there may be further action, and obviously we will stand up our plans, which do stand us in good stead with Kwame's team support and the EPRR team. They do work well, so and we see very little disruption to our services. So I'll stop there, Caroline, but very happy to pick up any further questions.
Thank you very much. Let's take questions to Michelle or Lynn or any other executive directors' comments on the report. Steph.
Thank you, Chair. Thanks, Michelle and Lynn. Yeah, just a couple of things. First of all, just to welcome the initiatives related to the 10-year plan, the modern service framework for severe mental illness, which is a bit of a mouthful, and the acronym's even worse, I think, for that. So, and the mental health strategy. I think that they really welcome the focus on mental health this year. Lynn mentioned that we submitted several. Or you did several care pathways for the severe mental illness work stream. It'd be really helpful actually just to have, if we could have a summary of those as board members, just so we can get a feel for what we as a trust might be looking for there as that strategy develops. So that would be really welcome. And similarly, the mental health strategy call for evidence has been launched. Again, it'd just be helpful to have a summary of what we're submitting there, just so we can be cognizant of the trust perspective on those issues. And finally, just a small question around clinically ready for discharge, which is mentioned highlighted in the report. Obviously it's important, but I know our numbers on this are really quite small, so it'd just be helpful just to have a feel for the small numbers, but are they significant numbers in the grand scheme of things at the moment?
Thanks, Steph. And I will, yes, we will collect the things on that are happening both on the modern service framework and the strategy alongside everything else as well, and try and keep you posted either through the chief exec's report or a separate brief. So yes, we will do that. And I'll hand over to Lynn for the question on the numbers.
On the clinically ready for discharge staff, the area that we're actually seeing most pressure at the moment is our older adults in mental health beds. So they account, as it stands at the moment, for about 10% of our bed base is occupied by a patient who is ready for discharge. So we are raising that because actually, if you look at the older people's out of area position, if we had those beds obviously available, had achieved timely discharge, that would obviously positively impact the use of out of area beds. We would see those reduced. So we are working hard with our ICB colleagues and particularly our local authority colleagues when we look at sort of what those patients are actually waiting for older people. It's often those residential packages of care that are causing that delay as well. There's been a lot of work that's happened in the system to improve that for the acute hospitals. I guess what I'm asking for and escalating in the system, Steph, I can assure you at the moment, is how we get that parity across mental health delays as well. So it is a very clear focus for us right now. I hope that answers your question.
Thanks, Lynn, that's helpful. Is it a particular local authority or is it just across the board?
It varies, Steph, but there is a particular local authority that we're engaging at the moment. It's East Riding. We're having conversation. It can change, but right now those pressures around delays are the ones that we are working with East Riding on.
Thank you.
Thank you. Kath?
Yeah, thank you, Chair. I've got two questions and I'll start with my second because it links to Steph really on that clinically ready for discharge. And we picked it up because it's also sat in the board assurance framework and we had a brief chat about it at the audit committee because it is listed in there as one of those control areas which the organisation's working on. And it was just reading that paragraph in the report at the bottom of page 12 around the specialised placements, and I just wondered, you know, when we had our discussion at the board strategic time out, are there any opportunities for Humber in being also a provider of any kind of specialised provision? Have we looked at that?
Can I come back in? Is that all right?
Yes, sure.
Yep. Kath, yes, we have. And that's been some really positive work actually that's being carried forward by the Mental Health, LD and Autism Collaborative. So work started to work across the provider trusts in our ICB, and some really positive reductions have been seen in clinically ready for discharges because of that. So for example, Kath, that's why our psychiatric intensive care unit plan is so important. That will not only reduce the use of out of area beds for us and address the sort of flow, the clinically ready for discharges, but it will also sort of help the wider ICB as well. So obviously that's a specialist service. It's problematic in terms of numbers of out of area placements, and we have a plan to address that. So I think the other area that I've talked about obviously is older adults. That's quite difficult when it's social care that we're looking for. However, and there's been some great work done about specialised rehabilitation and those types of beds as well, collaboratively across the ICB. So the short answer to your question is yes, we are looking at all of those specialised placements and how we can address that either ourselves directly or in collaboration with our other providers.
Thanks, Lynn. That's really helpful. And then my second question was just around one of the policies, so the sickness absence management policy. And obviously we all know we've talked about sickness a lot, and I'm sure it'll come up again on the agenda later today. So it's good to see that the policy, and it's kind of saying it's been completely reviewed and revamped. It says it's a new policy. I'm sure we had something with a different name perhaps in the past. So it was just that if there's going to be some significant changes to how we manage sickness absence, sort of the support to, you know, line managers and teams and their expectations from the new policy. Do we have some kind of a campaign or a training programme to go around that?
Should I start then? I'll pass over to Vicky if that's okay. Yes, I mean, we've completely revamped it. Obviously, this has been done in conjunction with staff side as well and with staff. So it's been a long time in the making. One of the things that the exec team said was exactly that, Kath, that we needed almost to do a bit of a launch on it. And some training for individual staff members and managers as well, but particularly managers to be able to navigate through and support them, because that links into the plan that we've already got for our sickness absence management, because obviously that's one of our key focus areas. So the two are converging really, but I'll pass over to Vicky to give you the detail.
Yes, thank you, Michelle. Yes, there will be a training module created, but it will also be weaved throughout from the induction. So it will be picked up at induction. There will be resources available, how-to guides for people to link in with after they've done the training, or if they're in a moment in time and they want to pick it up. So there will be a plethora of resources alongside training from day one of employment, alongside managers' induction and the module in the training itself.
Yeah, good to know. Thank you very much.
Okay. Okay, Kath, thank you. Phil.
Yeah, the 10-year plan analog to digital shift places quite a lot of emphasis on the NHS app, and I was being interested at how we're adopting that and what the impacts that are for. And there was something in the report about the NHS app and disclosure of unexpected results, which is obviously a key safety issue. I just wonder whether Kwame could just say something about that, but if it's complicated, I'm happy to receive a briefing outside the meeting so I can understand a little bit more.
Yeah, no, it's a good point. I will pass on. There's quite a few things there actually, Phil. Maybe we could do that at some point. Maybe a bit of a strategic meeting, just have a quick look at that. Pete can give you a bit of an update on that, because we're actually leading quite a bit of that work as an organisation. Part of the work that we've done on Interweave, but also the work that we're doing with Wayfinder, and then Kwame can do the piece of work that we did about results on NHS app as well, because obviously we've done a bit of a review on that. So Pete, and then is that all right, Pete? Do you want to give a bit of an update on that?
Yeah, of course it is, Michelle. So just in
okay.
terms of development of the NHS app and the single patient record, obviously we're the host for Interweave, which was the Yorkshire and Humber Care record, but it's a care record that's been used by multiple integrated care systems. You know, we are in advanced dialogue with NHSE about supporting the development of the single patient record, which will integrate with the NHS app. And obviously we'll take updates through the Finance Committee as that work progresses, with the focus on digital now going to the Finance Committee. So we're in a good position for it's probably not going as quick as we would like it to, but then sometimes digital goes in peaks and troughs, doesn't it? And then in terms of the unauthorised records, I'll hand over to Kwame, but I'm happy to support as well, Kwame.
Yeah, thank you. So there was a letter from NHS England which suggested that patients were having results done, especially pathology, histology report, let's say for cancer, and that was put straight into the NHS app. So patients were seeing the results even before they've had opportunity to go and do a clinical conversation with the clinicians with support. Obviously, this was something that would cause a lot of upset for patients who would see their result first on the app. So the letter came in to say if your systems directly links to the NHS app, then you should do something about it. We look at our current system and it doesn't link directly with NHS app, but that could change when we go to Wayfinder. And if it did, we would put a lot of mitigation in. On the same vein, if we have letters which are going to GPs which would have upsetting information, including patients, third-party information, we do make it very clear to the GP to make sure that doesn't go straight into the NHS app. And we have conversation with patients, such as memory clinic, we would have the conversation with the patient before that goes. So we have safeguarding in our trust to make sure we don't fall foul of this upsetting conversation that has happened. I'm happy to talk to you about it later if you want.
It's such a vital area. It's such a vital area that you get your results quickly, but that any adverse results are communicated by a human being. So it's really important we have strong processes in place. Thank you.
Thanks, Kwame, and thanks for including that in your section of the Chief Exec's report, because I think it is important. It does sound to me that it's a thing where we, across the NHS, we have to think about patients first. And whilst I'd like to believe that we can rely on GPs to do that, but maybe GPs aren't actually looking at the threshold of what's important to go, could go on an app and what couldn't, who they're leaving that to, maybe a decision that person really isn't in a position to make. So I think, you know, for our partners, there's assurances there, but I think it's really important. The other thing I just wanted to sort of pick up on related to that, and I know we have very strong protections here at Humber and deal with things like this really quickly, but the coverage recently of staff inappropriately, both in the health service and I have to say in the police, accessing private information is absolutely, you know, abhorrent, really. And and I think there's an issue about always reinforcing the message to staff that and being clear that you do not use that information just for your own curiosity on any situation, let alone when people have suffered enormously. But yeah, okay. Can I just check in on one thing? I can't see any hands up. And it may be that I've just misunderstood it. But Lynn, in your section of the report on page 13, you talk about, you say the overall staff absence position has deteriorated slightly in April and recovered in early May, and sickness is currently at 6.2%, 2.26. And then in the HR one of Karen's, it says there's been 4 consecutive months of incremental improvement in overall sickness absence, with monthly performance returning below the 5% target in March. Have I misunderstood this, which I might have done, but it just read like a contradiction to me.
So the 6.2 in my report, Caroline, includes mat leave as well.
Yeah.
So that makes the difference in the percentages. And Vicky can comment, but actually there was a slight increase in absence in April. But it has, I see an operational report that has the position every week in it. So it doesn't describe, it's Vicky's report that gives the detail between long-term and sort of short-term absences. I'm reporting the overall position from an operational perspective. So it did slightly increase, but I'm seeing the operational reports now through May. Obviously we've had 2 of those, we'll have another one this week. That increase looks like it's reduced again, but it's Vicky's report that will give, and Karen's report that give that sort of long-term view, and they give obviously the rolling position as well across all areas. So it was a moment in time, Caroline, my report. Does that make sense?
Yeah, no, that makes sense. I did note that included the maternity leave as well, and I was trying to deduct the numbers for that from the percentages. But yeah, thank you for that explanation. Thank you. Okay, great. Let's move on. I can't see anybody else's hands up. Obviously, we had the communication board report as well. I thought it was excellent, just to put that on the record too. And just to say, based on the health stars as well, what a great result for the golf day. And I have allocated my services to Michelle Moran to support her in her challenge biz in July. So all comers are welcome to support with that. Okay, publications and let's approve we have to ratify the policies. So I'm going to just go through them and just get an indication from all of you. Social media and website, happy to ratify. Bullying and harassment resolution, happy to ratify. Disciplinary, yes. Sexual misconduct policy update, ratify, yeah. Recruitment and selection, happy to ratify. Document control policy, yes. Patient safety incident response framework, happy to ratify. Entry and exit for non-secure mental health and learning, happy to ratify that update. Oh, Kath, sorry, your hand's up.
No, I put it when you talked about the comms team, just because I had an excellent visit with the comms team last week, and I wanted to say thank you. So they were talking about the Malton Hospital Golf Day and the work they've done to support the staff survey and the flu campaign and recruitment campaign, and just really kind of interesting, motivated, engaged, committed team to meet with. So just to pop my thanks there.
Okay, sorry, I missed you on that. Just to finish then, entry and exit for non-secure mental health and learning disability inpatient units, ratification, inpatient leave, yep. And finally, sickness absence management. I like to sort of say them all out because anybody watching this might not know what updates we're doing to the policies and do those individually. Okay, that's great. We have ratified all those policies, and we'll feed back to comms your comments about your visit to them. And don't forget, to non-executive directors, you can arrange visits to our non-clinical services as well as our clinical ones too. Great. Okay, let's move on then to the publications and highlights, policy highlights report, Michelle.
Yeah, thanks everybody. It's the usual report. These are some of the main, just for our new colleagues, these are some of the main publications that come in that haven't appeared in the Chief Executive report or haven't appeared anywhere else. And we just look at them from an exec team capacity and put a couple of lines in to say how are we taking those forward across the organisations. It's just to give you a bit of a flavour of some of the key things that have come in that will affect or maybe we're working with as an organisation. So they're there for information with the lead director. And again, I'll just throw it out for comments, Chair. Thank you.
Thanks very much, Michelle. Always interesting publications, and the note from the Humber saying how it affects us is also really helpful for us. Any questions? No? Worth a read when everybody gets a chance. Okay. Let's move on then to the Board Assurance Framework.
Sorry, Caroline, I think Phil had his hand up. Sorry, did it go?
Sorry, it didn't pop up on mine. Phil, sorry.
Yeah, just really briefly, just item 12, which is supporting young people to transition into adolescent and adult services. It'd be just great at some point. We have had some discussions in the past, but just some examples of how we do it in the trust. It's a particular passion of mine, and locally we set up a service that was 16 to 25 for people that were struggling with mental health problems that was non-medicalised, and it's just really be interesting to see how we manage that transition. Often as a GP, we used to see in the past, less so now, people fall in between service stools, and so I'd just be interested whenever appropriate to get some updates of how we manage it. And I have in the past, but I'm always interested in how it works.
Yeah, it's a good question for Quality Committee, Phil, actually, in relationship to handovers and things, because we've done quite a bit of work on that. So maybe it's something you want to have a bit of a briefing via the Quality Committee.
Yeah, that sounds like a good idea.
Great. Lovely. Thank you. Okay. No other hands up. I also be interested, I have to say, in the Martha's Law work that's being done on that by Humber. Obviously, it's been mainly in the acute sector, but it is quite amazing that there's been 10,000 calls and 1 in 3 of them have led to, I think, a change in terms of treating that individual. I think that speaks for itself, doesn't it? And I know that work's going to be done on that by operational side to look at how we might incorporate that within our service as well. Okay, great. Sorry.
Not the operational team. I think the exec team and the relevant folk within the organisation will be picking that up. Lynn started it off through the EPO, the emergency planning, sorry, for our new colleagues, emergency planning piece, and doing a good piece of work on that. And now, obviously, because of Pete at Portfolio of Estates, he's the lead officer. Pete, a couple of quick words, or maybe Lynn, I don't know, and then we can move on.
I think this might be a different one, Michelle. I think Martha's Law is about urgent review of care. I think what I picked up exec lead for is the terrorism one. Both sound very similar. It confused me when I read it, I've got to be honest.
Martha and Martin.
Yeah, it's because we talked about it yesterday at the
exec team. Martha's Law. Exactly the same.
Yeah. So it's back. This is back to Kwame. Kwame's the lead. Yeah. Sorry, I just absolutely well spotted. We had a long conversation about the other one yesterday, the terrorism one.
Yeah, that's Martin's Law and then Martha's Rule.
It is.
Oh, sorry, Martha's Rule. Was that my mistake? Sorry.
Yeah, Martha's Rule. So it's
hearing the law in my mind, you see. Sorry, Kwame.
Predominantly in acute and places where they have ICU, and all the work has been done in acute, but we've taken some cue from there in terms of deterioration patients on our ward, and also using second opinion doctors process to make sure that if patients want a second opinion, that is expedited very quickly. My understanding is that pilots are being done in mental health trust to make sure that we understand how we can use Martha's rule in a similar way. So I'm watching the space. As soon as something comes up very, very quickly, we'll make sure that we are an early adopter of any learning that comes from that pilot.
Thanks, Kwame.
Thank you.
Thanks very much. Okay, then we'll move on then to the board assurance framework item, and we have Oliver with us.
Yeah, thanks, Chair. Welcome, Oliver. I think he is joining us. So this is obviously to provide some assurance against the BAF. Obviously, we've done a lot of work on BAF, including the internal audit report, slightly amended format, which hopefully picks up those commentaries and conversations that we've had. So for the trust to review the current iteration and offer comments, obviously it's been through committees, etc. But good morning, Oliver.
Good morning, Michelle. Good morning, everybody.
Morning.
So yeah, just to follow on with what Michelle's already introduced there, just some key points. Obviously, we have further developed the template just to take into account the feedback from internal audit. Although we did receive significant assurance, I think as ever, there was points of learning for us to take forward. So that's now been fully adopted and incorporated into the template. We've also done it in consideration of the annual strategy review that we've undertaken recently as well. So that report, which I think features later on the agenda, has also been to audit committee. And it's just hopefully to move us towards an even, I suppose, more mature approach to the board assurance framework within the organisation. Obviously, there's plans to bring it to future boards outside of its kind of review metrics and timescales, just to support discussion and make it a really live document, and to obviously take forward any further points for consideration during the quarter as we're developing the document as well. So I know we've had some really good feedback from the committees that reviewed the document so far. This will be obviously the template that we use going forward. As ever, I welcome any feedback, but this represents the Q4 position, essentially at a point where we'll look to close it down after this review, and then we will commence with the Q1 iteration for 26-27.
Thank you very much, Oliver. I thought it really reflected much more outputs actually, and in more detail, and reflected, I think, some of that input from those board subcommittees into that discussion as well. So I thought that was really good to see. Can I just ask one question? I noticed that on the timetable, the target dates, because one of the things I think the independent audit said was about timescales. They each say next checkpoint June 2026. Can you just explain that for me and maybe for others? Does that mean that there's going to be a checkpoint every month with all the people who are leading on these areas, which then will update to the board? So does that mean in July board, I'm going to get next checkpoint?
Yes, so what we've been looking to do is bring regular check-ins, because a lot of the actions obviously linking with quite wider ranging pieces of work. I think the feedback, particularly in the internal audit, was where I think we'd reference some actions as ongoing as opposed to having timescales. So I think any that we can close and obviously will address within, as part of the quarterly review, that will be reflected on the document. These are, I suppose, some more the actions could take a little bit longer in time. So we will be bringing updates. So although it only comes, I suppose, formally as part of the quarterly review, we're still going to look to incorporate and updates to the actions for every iteration that comes, just so it's keeping it live as we progress in quarter. So next time you see it, although I won't be here, we'll be looking to have a full update on all of the actions.
Thank you very much for that clarification, Kath.
Thanks, Chair. It was just a bit of support to Oliver as well, what he said, because the audit committee received this really, really well at its last meeting. It was much clearer. I think it's much easier read and easier to see what we're working on to mitigate and manage the risk. And it was just a plea really when committees are looking at it, around that comment that the internal audit made around, is the risk level still appropriate? So let's say if we've closed any of those mitigating actions, has that brought the risk score down, or is there other information that we're aware of coming into the board assurance framework that actually would increase that risk? Because it's supposed to be a live document. So I think one of the comments was around that staticness of the risk scores, notwithstanding there was a great level of information in the document, but making sure that we were reflecting our conversations, whether the risk level and score was appropriate at committee level, and then that coming up to board to sort of support an increase or a decrease, because both are equally as applicable to the board assurance framework. So it was just a bit of support, Oliver. Thank you.
Thanks for that reminder, Kath. And maybe we can just sort of think about just something going to all the subcommittee board chairs just a gentle nudge to remind that that's part of their discussions when they're looking at this at their committees. Are there any questions about any of the specifics in terms of the outputs that are happening, or for that matter on the inputs as well, that any colleagues want to raise or ask about? Sarah and then Phil.
Thank you, Chair. It was just in response to your comment, Kath. What we're going to be doing with the front sheets that go to the committee is kind of put the challenge questions in, so that then we can do those challenge questions, and then we can really strengthen that assurance through the chair's report that then's coming to board as well. So I'm going to keep sure so that we've got a consistent approach across the committees, and also it supports the chairs in those sort of challenge questions as well. So we'll make sure that that's a consistent way moving forward.
So we'll have a standard set of questions for each subcommittee, and then if they have changed anything, that should be in their assurance reports that come here. That's a really practical and good way forward, it sounds to me. Thank you for that, Sarah. Phil.
Yeah, in 2026 we'll be looking at prevention, wellbeing, and recovery at Quality Committee, but there's quite a lot of primary care general practice inputs and a few outputs that'll need to drop out. So we'll look at other things that we feel that are good evidence, but that obviously as contractual changes happen will need to reflect the BAF.
Thank you, Phil. Okay. I can't see anybody else's hands up. Have I missed anybody? No, I haven't. Okay. Thank you very much, Oliver, for that. Good work. Thank you for everyone involved in that. Move on then to the next item, which is item 10, Risk Management Enabling Strategy Annual Report. Sarah?
Yeah, I think Oliver will probably stay on, but I'll just sort of I'll just introduce the report. So this is we received last autumn the Risk Management Enabling Strategy. So this is an enabling strategy to support the delivery of the trust strategy. And this is its sort of first review really against the actions within that strategy moving forward. One of the things that we've discussed through sort of audit committee with Kath's support as well is that we also produce a risk register annual report. So what we're going to do moving forward is the risk register annual report, and this report will be a combined report. We're going to strengthen the governance, and we're going to take it as a collective document also through the audit committee. But I'll pass to you, Oliver, for any particular details around the work that we've done over the last few months. Thank you.
Thanks, Sarah. Yeah, just to again follow on from Sarah's introduction there, I think this does represent the first kind of review, although it's badged as an annual review. I suppose we're about 6 months into the strategy life cycle. So as such, what we've proposed to do is undertake this kind of review on a 6-monthly basis. So it'll be going again to audit committee in November, and alongside the introduction of the kind of the risk management indicator element to that as well, we're going to be incorporating a suite of indicators that will support, I suppose, how the risk registers are developing over time, so we can see at a glance where are areas that we need to improve, where are we strong, and how mature we are as an organisation. So I think what we've tried to outline as part of this report is essentially our next steps and the key areas of focus to further develop the work within the organisation. There are some fairly, I suppose, significant actions that are detailed in the report, and some of them are fairly aspirational in terms of sort of future arrangements. The next kind of big step in terms of sort of the calendar of that work is obviously the risk appetite review, which is arranged for early July. And as part of that, we're going to be introducing some, I suppose, bespoke elements in terms of the work behind that and the evidence base and, I suppose, the resources that we'll use to support that review. So that'll be ongoing over the next few weeks. And that will allow us to kind of take a view on our risk appetite ratings with a view then to obviously disseminate that down within the organisation to support divisional and governance-led work as well. So I think we're in quite a good place. I think we have had some wins over the last 6 months. Obviously, it doesn't give us a full year, so we can only track so much of that work. But within the next 6 months, we've got some clear sort of goals to achieve, which will hopefully further strengthen our arrangement. And then that will tie in quite nicely with timescales for our next internal audit. So we have a clear plan, clear way forward. Happy to receive any feedback. I think it's been quite well received within the organisation at discussion at EMT as well as audit committee, but would welcome other colleagues' view as well for anything further you think we need to consider as part of that. Happy to add any additional points of work for us to pick up. So I'll hand back over. Thank you.
Thank you very much, Oliver. Any questions? I've got one, but anybody else got some questions or comments? No, hot thumbs up from Kath. Okay, just for clarification, I mean, I think it's a really clear report, so thank you both for that. I just wanted to just clarify, just in terms of our team meetings that operate around the trust and then other sort of meetings above that, but particularly at the team level, I just wondered how much, I think it's in there, but just for my assurance, one of the things is about lots of training to various people, managers and individual staff members. Have we got, if in terms of them addressing these issues on a regular basis, a part of the business that they do at team meetings, will you have a sort of, if you like, an assumption about when risk should be discussed at those meetings and how often, and a template for having the discussion? So we have some uniformity across the trust in terms of how that's approached. So when you're collecting stuff in, you can see, you know, well, how well some teams are doing it compared to others, but it's got data coming out of it or evidence of why something should be escalated or not, or changed, that you can really utilise.
Yeah, so we utilise a web-based system for capturing the risk registers, which is called Datix, which kind of gives us that structure that we need to support those reviews. As part of the operational delivery group, we track obviously the review timescales and that risks are being reviewed appropriately, that we're seeing sort of movement in terms of the scores over time, any risks that have been open greater than a year. So we've kind of got all of those metrics built into the system. It allows us then to flag any areas of concern or anything we need to pick up, which thankfully is very rare. I think we've got really good buy-in from the divisional and governance-led processes, and obviously the team risk registers feed into that. So yeah, we've got everything we need built into the system to support that process of review. I think it's probably around how we, I suppose, communicate that going forward as part of this report, and that's something that Kath has been supporting us on as well, in terms of sort of core indicators that will allow us to strengthen the report, but also, I suppose, evidence quite clearly how mature we are as an organisation. So that's something that will be a core element of the next iteration. I think this was the start of a 10, but obviously when it goes to audit committee in November and it'll come to board subsequently as well, you will see that further development work that we've already been discussing.
Okay, so the system's there, the framework's there, it's how people populate it and how they address the issues where the training comes in. Thanks for that. Thank you. Sarah.
And just an additional point as well, Chair, is that what we also do is if we've got any sort of areas that don't have any risks on the risk register, we also highlight that as well. So that's an area of focus, particularly our inpatient areas as well. So we ensure that it's not just those that are reporting, it's those that are not reporting as well, just to give us that assurance.
Thanks, Sarah. Great. Fine. Everybody happy with that? I can't see any other questions up. So thank you, Sarah, but also thank you, Oliver, for staying with us for that item today. Thanks very much. You're on again, Sarah. We have the Insightful Board report, agenda item 11.
Thank you, Chair. So this is the usual update on Insightful Board, CQC, and preparing for CQC, sort of well led. Obviously, we've been having lots of conversations through Strategic Board on that preparation for the CQC, well led, and some of the development work and bespoke sessions that we're having. Obviously, we will be commissioning our external review, and also we've got our internal audit programme to prepare us from a well led as well. What you'll also see in the paper is the update in relationship to the Insightful Board actions. Those have all been going through the committees on a regular basis. And I think what we're proposing through this report is that the remaining actions are factored in as part of the work plans for the committees, of anything that is sort of left over, and that we moving forward manage it as business as usual through the committees. Also, we've got that added assurance that we've just done the effectiveness reviews of all the committees, and obviously Insightful Board is part of that approach and template as well. So it should just become part of our annual cyclical approach as part of our committee effectiveness. But happy to take any questions.
Thank you,
And
Sarah.
obviously Stella, if I've missed anything, sorry, Stella.
Stella? Anything missed?
No, nothing missed on my side. Very thorough. Thank you, Sarah.
Okay. So our committee chairs happy with that suggestion that the areas on the attached in amber, they just go on as individual items onto your agendas to be dealt with. It doesn't mean we'll lose sight of what has already been done or come back to, as you say, that'll be embedded in, but to actually focus in on those ones that need some more attention. I think that sounds a good idea. Everybody happy with that? Obviously, it's the chairs of the committees. Yeah, that's great. Any other questions on the paper? Kath?
Yeah, thanks, Chair. And obviously it makes it a good read for a relatively new non-exec to see the progress that's been made as well on this and the evidence. I guess there was just one that just felt a little bit light. There's no page numbers. It's on the people and OD area where it talks about our lived experience workforce to evaluate the impact and continuous improvement. It just says this action is being picked up with the PACE team and it's complete, whereas I think the other areas kind of give us a sense of what progress has been made and how that's then been taken forward. This one just felt a bit light to me, so some clarification outside the meeting or wherever.
Thank you. Let me take Carrie and then we'll come back to Sarah. Carrie?
Sorry, I was on mute, thanks. Thanks, Sarah. Can I just ask about advocacy? I'm looking at my notes and I'm sure it was this paper that I read a bit about advocacy. Are we making progress on advocacy across the board as opposed to in mental health? I just couldn't see an update on the general advocacy, so I just thought I'd ask quickly about that. Thank you.
So just on the 2 points, obviously the lived experience one, I'll get more of a detailed narrative unless sort of Kwame or Vicky can comment on that particular action. In relationship to the advocacy, there was a conversation between chairs of Mental Health Legislation Committee and Quality Committee in relationship to where that sat. So the Mental Health Leg Committee already receives quite a bit of narrative around advocacy, but from a mental health perspective, which is the point that you were making, Carrie. But obviously what we've said is we need to make sure that we've got the same approach from a physical health from all services that we sort of offer. So Mental Health Legislation Committee is going to make sure that they cover it all in its entirety. So hence why the action now sits with Mental Health Legislation Committee. But also what we're doing is through the complaints annual report as well, we're making sure that advocacy is an area that's part of that and is also strengthened.
Okay. Thank you. Can I just come back on that? Is that okay, Caroline?
Yes, of
just,
course.
I think maybe just for from the perspective of perhaps inspection, we perhaps just to make it a little bit more overtly clear that that's where advocacy is sitting, but it's on behalf of the physical health as well. And it just didn't read terribly clearly to me at that point, but you know, I might have missed something. But
We can strengthen that.
Yeah,
that's fine. We can
strengthen
it.
Yeah, I mean, you can end up with these things ending up in a place, but it doesn't make sense to the outside world. And it could end up, let's be honest, getting lost or not as visible as the mental health side. Do you want to take that, perhaps, right, can we have maybe sort of go away and think about that, Sarah, and rather do it on the hoof here? Maybe discussions to come back, you know, to board, not a meeting, but just to have a think about that. And the other point that Kath made about the evidence in the paper around the actions on patient experience. I don't think we can solve it at board today, but I think those 2 points are well made. Is that okay, Sarah?
Yeah, great, thank you.
Is that all right with Kath and Carrie as well? And then we could just let board members know by email what maybe the changes have been. That'd be great. Okay. I can't see, Steph, you had your hand up. Did you want to come in, or you've gone down again?
No, it's fine. It was answered.
Brilliant, thank you. Okay, thank you very much for that. So obviously everyone said they're content with your suggestion about taking on the actions not completed to stand as individual items. And we've got a couple of those other queries that to give a little bit more thought to outside of board. I'm sure we can sort that out to everyone's satisfaction. Thank you for that, Sarah, and thanks to Stella, and also pass on thanks to Kate as well, Baxendale, for her work on this. Thank you. Okay, we move on to the next one, and Kwame, you're leading on this antimicrobial stewardship, please.
So antimicrobial stewardship is for board oversight, and antimicrobial stewardship means that we all have a responsibility to make sure that we don't use antibiotics and our behavior doesn't lead to antibiotics resistant. I'm sure members of the board would have heard about antimicrobial or antibiotics resistance happening, and NHS England is very keen that we can protect our future. So every organization is to provide an assurance to their board that we're doing everything we can to make sure we're doing our bit to help. Before the letter came, we were already on the path already. We had our antimicrobial plan 2024 to 2027, 2024 to 2027. We also have been discussing antimicrobial processes in our healthcare associated infection group. We've always had audits of antimicrobial. We prescribe a few of them, and we make sure that pharmacy oversight, it is prescribed appropriately in line with 9 guidelines, and we do regular audits about it. In terms of self-assessment using the Section 3 of the Infection Control BAF, we've gone through that, and we have completed all our actions in line with the expectation of the national framework. And we continue to strengthen the process and continue to do audits. So board should be assured that we are doing everything we can to make sure that we can do our bit in terms of making sure that antimicrobial stewardship is upheld in this organization. And I'm happy to take questions.
Thank you, Kwame. Any questions from board? I think it was a pretty clear report, Kwame, so thank you for that, and the front sheets and the attached. Okay, so we are being asked to approve for this. Everyone in favour? Oh, sorry, Sarah.
Sorry, Chair. It was just a comment. It was obviously just to say that obviously as part of my role as the Director for Infection Prevention and Control, that my team and Kwame's team work really aligned. So it's really important as part of that antimicrobial approach that they work really well together. So very much supportive of the work that's been done. So just to sort of give that support from myself as the DIPSI, but thank you.
Thanks very much, Sarah.
Thank you.
Okay, happy to approve the report. Thank you very much. Okay, we'll move on to item 13. Lynn.
Thank you, Chair. Yes, so I'm pleased to present to the board the Emergency Preparedness, Resilience and Response EPRR annual report. I'm bringing you this report as the Accountable Emergency Officer for the Trust. In the report, it hopefully demonstrates to you that the Trust has met its requirements within the EPRR duties and obligations set out in the Social Care Act. It reminds the board of our self-assessment against the National Core Standards last year, the progress that we made in relation to that, and obviously sets out that we will continue to work towards full compliance with those standards over the coming year. It sets out the importance, obviously, of the training that we've completed over the last year as well, and that has been quite significant in order to meet those core standards. The testing that we've done, particularly in relation to our business continuity plans, the exercises, both internally and externally, that we've involved in, and the lessons sort of learnt through those and how we take those into preparing and improving our plans. Obviously, there has been, as the report describes, a number of EPRR related incidents over the last year. Those are summarised in the report as well. And then finally, it sort of sets out our sort of key priorities for the coming year. So as ever, I just really want to thank our very small but very knowledgeable and experienced EPRR team as well for the support they provide around this agenda. And I think this report hopefully positively reflects the work that they've been engaged in over the last 12 months. Happy to pick up any questions, Caroline.
Thanks very much, Lynn. Please pass us our thanks. How small is the team?
It's 3 people in all told.
So those 3 really important people
3
in the
really
trust,
important
for
people.
the record, thank you very much.
Thank you.
Steph.
Thanks, Chair, and thanks, Lynn. Lynn and I have had the opportunity to engage on this report prior to the meeting, which was really helpful. Yeah, just to reiterate, thanks to the small team. The team leader's been in place for 12 months and has done a fantastic job over the last year. I reflected back on where we were in 24 and 25, where we had a huge number of partially complete areas, and I think we were having a little bit of concern about this area at that point. It's really turned around, and particularly the focus on business continuity, as Lynn's mentioned, has really achieved results in the overall picture. And it's interesting, the huge range of incidents that we've actually been involved with has given a great opportunity for learning and assurance for the board in terms of the systems and how we continually improve them and learn from them as an organisation. So really commend the report, and really great progress on this area.
Thanks for that, Steph. I echo that. Those of us who've had that discussion over the last few years really can see that level of commitment and progress being made. Okay, thank you very much, Lynn, for that. And we can move. We're going to have a break now. You'll be delighted to know. It is 11:15. Come back at 11:25 when we'll have Akiva there here to provide some added texture to the staff survey. See you in 10. Thank you. Emma? Emma? Have you stopped streaming? Okay, just for usual reference, normally James would sort of, the beginning of the meetings count as in down to 3, say, and then when it's 3, that's it, we start. And then at the end of it, when we break like this, just tell us when we stop streaming so we can just relax a bit. Okay, thank you. See you in 10. Bye. Okay, welcome back to Humber's public board meeting on the 27th of May, and we restart where we left it on the agenda. And I'm pleased to have Jez Sims with us from Akivia. Hope I pronounced that. Is it Akivia? This is Akivia, isn't it? Have I done that right? Who's done some independent work on the responses to our staff survey for board. Obviously, we've had some discussions, interim discussions about some of the results, and actions are already underway. But Jez, looking forward to hearing from you this morning. Welcome.
Excellent. Thank you for the introduction. Hi everyone. I'll share my screen now, so hopefully you can see the blue cover page. And I'll jump straight in. But really, the idea is, rather than looking at the 2-year data that maybe you've seen in the management reports and other pieces that IQVIA have prepared so far, this looks at the 5-year data set. So we're using the published data. There's a few advantages to doing that. In particular, it's easier to look at the trends. It also enables me to look at areas where the changes over the 5 years have been creeping. And that can often reveal something that's equally as important, but that may be missed because it doesn't say statistically significant decrease or increase. So it lets us have a broader picture. So let's jump in and really start with that 5-year story before going into a little bit more detail. And really that 5-year story is broadly positive, which is always good news. And hopefully none of this comes as a shock to you. But I think what we get here is that you've sustained strong cultural foundations through sustained system pressure. And those pressures, and I've said this to a lot of trusts so far this year, are repeated. Everybody seems to be having the same sort of issues that come from the state of the UK, the state of the NHS as a whole, and moving down into how each trust deals with it individually. So, you know, this looks particularly at compassion, at team working and flexibility. And all of these things matter, because those strengths tend to act as resilience buffers when things are tough. And where this becomes really quite finely balanced is that momentum no longer builds in the same sort of way. So what we'll see as we go through is that areas that have improved over a few years are now flattening or dipping slightly. And I think that's true particularly in recognition, development and involvement. And engagement and morale as overriding themes remain comparatively healthy, but again, they've leveled off rather than continue to improve. So that's not a red flag, and I don't want to be really depressed about it, but it's more of an early signal. So it creates this sort of opportunity to act early, to protect what's working, and all these things that no doubt you've already mentioned today, where you can feel proud as a trust. They're the things where it's about just making sure that you can continue in that vein. So it's about, from these results, it's about focusing your effort on things that most strongly shape staff experience day to day. So that's recognition, it's career pathways, it's staff voice, and it's workload management. So I think, you know, when we go through this in a little bit more detail, you'll see how everything knits together. And by the time we get to the recommendations that I'm going to make, they'll be based on everything that we talk about here. So they're based on what I can see, rather than your 5 lowest scores, which you'll have had in the management report and anything else that we've shared with you. That's not to say that you ignore the 5 lowest scores. They're interesting in themselves and worth looking at. And it's also not to say that anything that when we get to it that I recommend means scrapping everything that you're already doing and ignoring the initiatives in places. Hopefully it's just a case of tweaking, which I presume you do anyway. You know, we don't just create a plan and run with it. Just a quick look. So brief overview. Quick reminder as we go through. So why engagement matters and how we can bump up that sample, get more people to take part in the survey, a little bit about the methodology, the response rate, and then go through the results. So really that's a case to explain a bit more than I already have, to do a bit of a SWOT analysis, which is quite interesting, and then really have a look at those 5-year trends for engagement, for morale, and for each of the people promises. And then basically, like I say, it's opportunities, the recommendations that seem to come from those, and a few next steps. So starting with why the staff survey story is really not just an HR story, not just an OD story, it's a leadership story, and it's something that hopefully you're fully aware of. I think this matters at every kind of level, but staff engagement is one of the clearest indicators that we have of whether change is deliverable in a practice, if frontline experience is stretched, or if reform slows, or if any strategies are working. And one of the key things is that it's not about admiring a set of numbers. It's not about getting upset with the numbers. The whole 5-year pattern implies that there's resilience and sustainability, and it really lets you focus on where you can actively and effectively protect the momentum that you've had. So really, before we interpret those results, it's worth just checking the credibility markers. So that's timing, the sample approach, the response rate. So as you know, the survey was the fieldwork was being conducted between September and November, and it does make a difference, because if people were having, if there was good news that was being shared at that time, or bad news, or, some things that external to the trust that were going on, they affect people's mindset. And that's true of every piece of market research. So it is worth thinking about what was happening at the time. The other thing is you've got a sample of 2,168, so 64%. One, that's a fantastic number. That means that you're one of the higher of all the trusts, which is really good. And it means that they're engaged. It's not a case of what about the other 36%, because very few make it into the 60s. So that side's really good. Where that's important really is that the bigger sample that you get, and this is why you should always keep pushing for more, the bigger sample you get, the bigger the samples are when you start breaking down by directorate or by demographics, or however you want to cut that data up, because the more you've got, the more sample you'll have in each of those breaks. But for a trust as a whole, and certainly for what I'm looking at, these are great numbers. It's statistically very, very relevant. In other words, what we see, we know is truthful. And, the margin of error is really small compared to if we asked every single person in the trust and made sure that they all completed the survey. So this is great. Bottom right-hand side, that line highlighted in blue, a little bit less relevant for you guys, because 64% is a great response rate, but it's really about how to encourage even more people to take part, and that's about explaining that that really the reason to do the survey isn't a box ticking exercise. It's about having your say, and people are only going to believe that if they have their say. You share those results with them and you say, well, this is what you are telling us, and this is what we're going to do about it. And even better, this is what we're going to do about it with your help. You, as our staff, are going to be involved in solutions and in initiatives. If you're already doing that, brilliant. If you're not, it's worth considering. Just advice. Okay, let's get into the results then. And we'll start with the overall, with that SWOT analysis. I think what we get here is that your strengths are really clear, and obviously they're really important. So, consistent, compassionate culture, strong team working, flexible working, and across those 5 years, these are really quite, they're acting as stabilizers. So they help you as an organization to hold your shape, even during sustained pressure. And I'm sure even beyond the normal pressure, you'll be able to think of a few other key points there. I think the weaknesses are also pretty clear. Reward, recognition, and development have kind of plateaued. And that matters because these are areas that convert commitment into sustainable commitment. You know, people want to know that they're doing a good job rather than just feel like they are. They need to know that they are and that there's a chance for progression. So the opportunities then, and these, I think these are really, really good position. You know, early attention from you in terms of recognition, voice, career capability are a really good way to protect morale and retention while pressure is still manageable. You know, people are in a good mood, pretty much. So it's a really good time to approach them and make it even better for them. And then finally, the threat. And the threat isn't collapse, it's actually erosion. So in other words, you're in a good position, but not doing anything, not keeping that ball rolling, not keeping progressing, just means that you can always just peel off layer after layer. So in that sort of situation, what we find is that stability, which is where you are, can mask gradual drift. So small year-on-year dips become more structural and become more noticeable when you compare to 5 years ago rather than this time last year. So really the whole remainder of this deck is about the evidence for, and I guess a response to that single point. So, you know, how do we stop that erosion? Okay. You'll see a lot of slides that look like this. Those of you who've seen the IQVIA version in the past, you'll have seen 2 years data and the comparator score, a load of green and a load of red and some grey. And I've tried to avoid that for 2 reasons. The first is we're quite a bit past the embargo being lifted. So it's better to look at 5 years data. The other thing is I strongly believe that your main competition, and this is true for every trust, but your main competition isn't really a comparator set, although you need those scores. It's yourself. You know, you want to improve yourself year after year. So just having those top line scores makes it a little bit easier just to have that focus. So what we get on this slide is really that engagement, and I've already mentioned this, but engagement is being sustained. So it's no longer being replenished. And you can see that just that little drop from 7.2 to 7.15. But that comes after rising from 2021 onwards. So, you know, you've just fallen back a little bit and it's not a dramatic fall, but that direction matters. You know, it's consistent, this picture, with a system where staff remain committed and they remain professional, but engagement is increasingly carried by personal effort rather than organizational conditions doing more of the heavy lifting. You know, you're relying on staff just loving where they're at and being committed. So I guess the implication for you is pretty straightforward. It's an opportunity to protect engagement by removing friction. So recognizing effort, reducing avoidable pressure, ensuring staff feel involved and heard, so that their commitment stays sustainable, not just now, but over the next few years. So I think if engagement is the energy to the system, the morale is how that energy feels day to day, and it often shifts when the pressure becomes cumulative. So what we get here is a pretty similar story. It improves strongly from 2021 through to 2024, and then essentially it's flat this year, 6.39 last year, 6.38 this year. So again, we're not really looking at deterioration, we're looking at a leveling off. And staff pride in care can remain high even when morale is sort of sensitive to workload and to potentially pace of change. And that's exactly why this matters. So pride can carry people, but it can only do it so far if day-to-day experience feels stretched, you know, all those sort of pressures that you get. So again, that opportunity here is really to treat this flat morale and look at it as an early signal. So it's a prompt to strengthen the conditions that sustain staff emotionally. It's to help them manage pressure, give them, and I've mentioned this a few times, meaningful recognition, and confidence that change is being done with them rather than to them. So again, that idea of them being involved is really key. Okay, moving on to the people promises. And starting with, we are compassionate and inclusive, and this is one of your strongest foundations. And if and the trend seems to continue and confirms what we're already saying. So over 5 years, the scores have gone up from 2021 to 2024, and then we've held where you were compared to last year. So my interpretation of this is that compassion and inclusion are steadying forces. They help staff keep going when pressure is high, but the plateau, even though it's only 1 year's worth, matters too. So when a strength stops improving, it can be a sign that it's being relied upon rather than actively replenished. And that's quite an assumption just based on 2 years worth of data. And that lets me raise another key point. The figures tell you, the staff have voted basically, but also you need to combine that with what you see, what you hear, what you witness every day around the trust, because that, you'll have that sort of idea, and it should corroborate what you're seeing here. There shouldn't be any surprises when we do this sort of survey. So the opportunity here is it's protective again. It's about maintaining consistency across the organization so that compassion doesn't depend on local luck, on which team you're in which area you operate. And it should ensure that inclusion stays systemic, because it's one of the biggest buffers against pressure turning into engagement. Okay, so if compassion is a cultural buffer, recognition and reward is one of the strongest levers that you actually have to help effort feel that it's sustainable. I think this is the time where trend shows a genuine change in direction. So those scores, as you can see, improved gradually from 2021 through to 2024. Apologies, just not done. But then dips back in 2025's result, back to 6.5. And that pattern, steady gains, then a bit of a fall, is exactly the kind of early warning signal that matters. So, even when the score isn't really that low, a dip after progress suggests that your staff are starting to feel that maybe the effort isn't being matched by meaningful recognition. And meaningful is a really tough word here. It doesn't have to stand for financial reward. Sometimes it's just about, making sure that people are publicly recognized. Sometimes it's about making sure that recognition doesn't wait for a monthly meeting where it's like, and now we'll announce employee of the month, employee of the week. Sometimes you do a good job. You just want somebody, particularly if it's your boss's boss, to say, hey, I heard about this. You're doing a great job. Because those things matter. It's great when someone who you don't suspect really knows what you do day to day actually congratulates you for what you're doing day to day. Little things like that. So, I think that's absolutely key. So the opportunity, I know this is one of the bits where I keep harping on about it, but that opportunity there is very practical at your level. It's about making recognition visible, about making it specific and routine. So it's not a campaign. It's not a routine in a monthly award, and there's 12 people in my department, so I will win it at some point in the year. It's more about it being a bit of a leadership habit, something that could happen every day, that thumbs up sort of thing. And definitely it's one of the fastest ways to protect morale and to encourage engagement without needing any sort of structural change and without needing to throw money at it, because it shouldn't just be about finance. I think recognition, sustains motivation, and voice sustains trust. So, it makes sense as we move through. And again, the picture that we get, voice improves from in 2021 through to 2024, and it dips back actually to the 2023 level now. So again, it's that same overall pattern, progress over a few years followed by a slight dip. Why does it matter? It's really clear. Voice is one of the strongest predictors of confidence in leadership, and also willingness to stay engaged through change. Staff definitely, and I've seen this in so many different trusts, staff want reassurance that their views lead to action and not simply that they were listened to. It's not you say something or you file a complaint and somebody goes, thanks for that. They need to see what happens after that. So follow through is absolutely key. Closing those feedback loops and being transparent, especially when action isn't always possible, and it isn't always possible, because that's where you can either be really strengthened or slowly continue that erosion. And I think it's there's just about making sure that people can see what's happening and explaining when something can't, or explaining when something might take a bit more time, but keeping people so that they know they're not wasting their time, that they've you're not thanking them, but you're just making sure that they're in the loop all the way through. Absolutely key. I think where that picks up is that when we move through, so voice and recognition, that's about trust and motivation. Safety and health, as we move on, they tell us whether work is sustainable in practice. And what we get here is quite encouraging, actually. So, those scores have picked up. A very, very slight dip again in 2025, but 0.02. So we're not going to worry about that. My interpretation here is improving but under ongoing pressure. And the reason I say that is that your score's still below 7. And it's a little bit contentious, because I've asked this a lot of time, and I've been asked by lots of trusts, well, what score should we be going for? Should everything be in the 7s and above? Do we aim for 8s and 9s? Because, that would make us look really amazing. And that's why I say, sometimes that comparator score is really tricky, because it can make you feel quite downhearted that the collective may be doing slightly better than you are, or much better, however it is. But definitely 7 seems to be people's minimum comfort zone, where they start thinking, well, these are, we're in a good place here. So obviously from 2021, you started moving quite quickly towards that goal, but it's just plateaued a little bit. So it's definitely one of those areas where acting now, doing something now, really helps protect from what could be coming, from that future strain. So it's a good time to recover. It's a good time to help reduce avoidable pressures. And there will be avoidable pressures as opposed to workload, which is quite hard to avoid. So it's about making it easier for teams to raise and resolve safety and wellbeing risks early, whilst they're still feeling pretty positive about everything. Okay, 2 more promises. So we are learning. I think this is the clearest area where lost momentum is actually, front and center. So learning did rise pretty strongly from 5.83 in 2021 through to 6.29 in 2024, but then it's fallen back to that, well, somewhere between the 2022 and 2023 level. So I think, this is definitely an area that should be looked at, and that it matters, because learning and development are really where staff decide whether they can see a future with the trust, whether they feel like they're growing, whether they feel like they're progressing, and whether they feel like they're being invested in. Not everyone wants to get promoted to the next role, but most do seem to want to include their skill set, improve their skill set, and get better at what they do, and certainly feel like the trust is helping them to do that. So when access to learning feels, uneven or that it could be sacrificed because of other pressures, you know, workload pressures, things like that, it can quietly undermine retention even when all the other scores look quite good. So the opportunity here really is just about re-energizing career pathways, that development access, and so that it's not seen as an extra, but it's actually, you know, from your point of view, a lever to protect capability and engagement over the next few years. And finally, for our promises, so we work flexibly. This shows strong upwards trajectory again from 2021, with that little dip back in 2025. And this is really commonplace. This exact picture, I think flexible working has become absolutely key over the last few years. But this is the sort of picture that I've seen trust after trust. And I think what that tells us every single time I look at it is that flexibility is broadly working, definitely works as a resilience enabler. Staff clearly value it. It helps protect their well-being. The caution is always that it's experienced unevenly. In some places, because from one department to another, you know, the way that you can do flexibility in all of its guises, you know, it can't be matched department to department. So it's about being open and honest rather than having people go, oh, well, I just won't be allowed. This is just what isn't possible, and being able to explain that. So where flexibility is supported, we know that well-being improves. Where it's limited, stresses increase. And it's that perceived unfairness that can often erode trust and eventually morale. So being upfront, being really open and honest, being able to say, look, you know, as a department, you know, it's hard for us to work from home, to have flexible hours, etc. But explaining why and what can be done and what flexibility means for that department is really key, and making it so that they're not there going, but this department can do that. And the worst thing is where it's, but my colleague in the same department gets this. So always being able to have a proper conversation and explain why it's possible for one, not for another, without it seeming unfair, is absolutely key. Like I say, consistency, clarity, applying flexibility fairly within all the normal realities that you have, and being really open about it, absolutely key. And I've seen this elsewhere, when staff understand the why, flexibility becomes a real trust builder rather than a friction point. And that's what it's there for. I think finally we come to team and team working. And the good news is that team working remains a consistent strength. Again, we get that same sort of picture building up to 2024 and then a slight dip this time around. And I think what I can see is that teamwork is at its strongest within immediate teams, which is very, very commonplace, and slightly weaker when it goes across departments, across those boundaries. And like I say, that's a really familiar pattern. Teams always pull together locally. It's not even an NHS thing, it's true where I work as well. But collaboration can become harder when capacity is tight, when priorities compete. So the implication, I guess, a lot of the time for this is that, you know, you have an opportunity to keep investing in those conditions for good teamwork, for, you know, clarity, communication, cross-boundary working, if you have the capacity to do that and the time to do it. Because when teams are strong, they buffer pressure and reduce workforce risk much better than when they're not, in that sort of sense. So I'm going to move on to recommendations now. What I've tried to do is structure them so that they all follow everything that I've said. So there'll be a fair amount of repetition, I guess. But also I've tried to prioritize them as well. So trying to keep it simple and basically go along the idea that the 5-year trends suggest that X, Y, and Z. So if we start, those 5 years trends, definitely, they suggest that staff experience is shaped less by policy and more by what happens day to day. So pressure, leadership consistency, and follow through. So 5 recommendations. The first is about reducing avoidable workload pressure, and avoidable is absolutely key there as a word. And basically, hopefully you're aware of this anyway, but pressure is the most universal driver of low morale and disengagement. It also touches safety, well-being, and retention simultaneously. So it's almost 4 birds, 1 stone situation. Second is about strengthening consistent day-to-day leadership behaviours, and this matters because staff experience varies, most by local leadership rather than role or policy. That situation where I've got a great manager, mine's a bit rubbish. You don't want to have that conversation going on, but it is something that you can control. A little bit of training, a little bit of coaching could really help that in quite a quick sort of win area. Third's about closing those feedback loops, demonstrating follow through, absolutely essential because trust is shaped by what happens after staff speak up. So it's not just, oh, they were great at listening, it's what happens next. And that's where you get the real wins. Fourth is about making recognition visible, routine, and meaningful. And this matters because it has to be valued as in the way that it has a disproportionate impact on morale and motivation. And we've seen even this time around with that slight dip, you've seen that the momentum has slightly softened in that area. So again, hopefully quite a quick and easy win. And then finally, just applying flexibility and inclusion more consistently. And that definitely leads to protecting the trust, belonging and retention, because it's the inconsistency that can be perceived as unfairness. So if you don't explain why you can't be consistent department to department, people do get a bit miffed about it. I think from there, so you've got these opportunities to really gain some good progress. Hopefully some of these already match with initiatives that you're already doing. I think that the next step is about disciplined insight into action, and that pathway that continues data and dialogue and follow through, which are absolutely key. So I think the practical pathway here is quite sound. Share the results if you haven't already, and be really transparent. If it's good, it's good. If it's not as good as you'd hoped, it's an opportunity, that sort of thing. Analyze the breakdowns. You'll have access to Solaris. You'll be able to take a view directorate to directorate, etc. And also use the free text comments to really add depth and context. Every trust I've ever seen, you give the staff opportunity to talk, they go, they talk, and they in this case type everything in. But really, it gives you depth to the numbers and gives you a good explanation. So if you've not already got on that, I would definitely recommend thematic analysis of free text comments. That is something that we could help with, but it is definitely something that you could do internally. The bits that also could be really handy, and it's really about helping helping your staff to reveal those themes, and therefore helping them to build an action plan and helping them to work out how everything's implemented, is really getting more depth from them. If you're after that sort of thing, staff focus groups or one-to-one interviews, things like that, the more qualitative side, but really focused in terms of what you want to ask. Again, it's the sort of thing that you could do, although you would not be particularly impartial. Oh, my manager's doing an interview with me. Not particularly great. And that's the sort of thing that I can help with, my team can help with. But you only want to do that if you've got specific problems or specific areas that you really need to know more about. As an example, recently, and this was to do with a disconnect between staff and their managers. So I created 2 discussion guides and held lots of focus groups, some with the managers, some with the staff. And basically, it was about discovering where that disconnect was. Rewards and recognition was a really easy example that comes to mind. Staff really like being recognised, but they thought that the managers could do it a bit more personally, and they didn't need the monthly award, and they were happy for a thumbs up sort of thing, because that's all they really wanted. I want to know I'm doing a good job. Whereas the managers were there going, oh, do you know what? We've just started this Employee of the Month award, and it was really well meant, but it didn't meet with what they actually needed, staff needed. So having those conversations with 2 different groups, both of whom wanted the best, just close that gap, and it was really quick and easy. The other thing, when it comes to action planning, you know, I've named 5 recommendations. Hopefully there's enough link between them so that really you're just prioritizing 3 areas to go to. You know, like I said, you're not in a disastrous area. You've just had a little bit of a dip this time around. So you're still in a position of strength. You're still in an area where you can build up and go from there, which is definitely a good place to be. Finally, thanks all for listening. I know I've thrown a lot at you in a pretty short amount of time, but happy to take any questions, listen to any thoughts, and go from there.
Thanks very much, Jez. Excuse me. And we'll share the slides with everybody on the board, so you've got a bit more time to take them on board and think about some of the comments you've made. Thanks very much, Jez. Okay, Vicky, your hand is up.
Yeah, it wasn't for a question. Can I just add to this?
Yeah,
if
sure.
That's okay, Karen. Thank you. I know Karen brought a presentation, or she presented last time at the board. So I just want to kind of reiterate some points that she said from a trust perspective. And thank you, Jez, for that. First of all,
hold on a second. Can we just maybe get rid of the slide so we can? Yeah, we don't need that. Thank you. Over to you, Vicky.
Yeah, thank you. So just wanted to kind of reiterate, and Jez did say this at the beginning, but we had the highest ever response rate within the trust at 64%, which gave us a really robust and representative picture when it came to looking through the responses that came through. The trust does continue to outperform national averages across all of the people promise themes, and the 2 overarching themes of engagement and morale. We scored higher than any other trust in the ICB region across all of the people promise themes and the sub themes. And also when we're looking wider across the whole North East and Yorkshire, we were 3rd out of 31 trusts when it comes to advocacy. I think it's just worth reiterating that advocacy remains really strong with us within an organisation. 70% of our colleagues would recommend the trust as a place to work, which placed us 7th out of 49 in similar trusts that are mental health, learning disabilities and community. And we've sustained year-on-year improvement at a time when several other high-ranked organisations have seen a decline. I know that Karen will have picked up before, and Jez did give a nod to it, some of the trust-specific areas that we're focusing on, which include appraisal quality, focus on health and wellbeing, which is your MSK and your presenteeism, raising concerns and speaking up, and feeling valued, which has just concluded, a listening exercise has just concluded, and we're just reviewing and analysing the responses there. So I just wanted to give that. I hope that's okay, Caroline, from a trust point of view. Yeah. Thank you.
Yeah, that's fine. Obviously, you know, it's there's a lot of positives in there, but I suppose it's that thing about, you know, where we look at the areas where we think what's working, what needs tweaking, what needs maybe addressing, and I think we've done quite a lot of that actually as a board since we had the presentations earlier, but maybe there's, you know, you can go back to that. Michelle.
Yeah, no, I was going to say very similar to that thing. Thanks, Jess, for that. I mean, I do think it's best to put it in that wider context. So thanks, Vicky, because obviously I think if you look at the NHS as a whole, certainly over the last 5 years, it's been dipping significantly. And even those that of 6 places above us, every one of those has deteriorated massively since their original position. So actually, we've made some steady improvements. We've had a couple of blips and we've gone down in a few. And it's so difficult in relationship. The questions are very similar every year, but do change a little bit, which is sometimes helpful, sometimes not. And obviously, it's a different cohort of staff. This is mainly for the new members, really, that it's something that we absolutely take so, I mean, everything we take really central anyway, but obviously staff are our greatest asset. And we have spent a lot of time 6, 7 years ago, we were bottom of the league table. And I don't just mean a little bit bottom. We were bottom by a huge margin across all the NHS. So that's not just learning disabilities, mental health and community trust. I mean, everything. And it wasn't just by a few points. It was massively different. So even though we've made a lot of difference, we have got to look at these results in that light and context, because we don't want them to continue to dip. I think for us as a team, the exec team have obviously mulled over, cogitated, and certainly the HR team and people team have just forensically digested everything. And I think Vicky could recite what's on paper 24 of the final report. We've also had a look at the narrative statement as well. And I think there is a bit more around how we continue to support and develop our managers in that cultural work. Because for me, as you know, I'm obsessed with culture, the staff surveys around culture. So that's why we've done a lot of focus on being Humber, particularly, which is our cultural framework designed by staff. So I think there's that. One of the things that wasn't touched on that we really sort of took a bit of a gas was musculoskeletal services, because we were hugely a huge dip, and we were quite an outlier, if you remember, and we couldn't quite understand why that was, because we'd invested quite a lot of money. And that comes back to the chair's point about let's just have a stock take, what works, what doesn't work, what we're doing well, what we're not doing well. One, so we don't throw the baby out with the bathwater, but also we do stop what we feel is not adding benefit. And we've done quite a bit of that over the last 3 months as an exec team, and try to sort of reinvest some of that money. We will continue to invest hugely in our staff. We do. We're probably one of the few organisations that continues to invest both in their development, which is interesting to points that Jess made, their department through Proud Programme, the alumni or the development opportunities, etc., but also the health and wellbeing. For example, we just sent out ice creams today to say thank you for working in the hot weather. What we need to get better at is the messaging of that this is quite unusual to Humber. That doesn't happen everywhere, and what we have to do is support our managers to follow that being valued piece, because that was the bit that really stuck in my view when I first read the report. So thanks for that, Vicky, that overview, and thanks, Jez. But still a lot of work to do, a lot of work to maintain and to carry on and to continue to improve, but some really good overall results. So I'll leave it open to questions. Hope that was helpful, Chair. Thank you.
Thanks, Michelle. Are there any questions or comments from other members of the board? I've got a couple before we sign off. Kath.
Yeah, I think it was just going back to something both Jez and Michelle just said there, and it was on one of the slides. I noted it down. It said staff experience varies by local leadership. Michelle, you've just referred to investing in managers to be able to, you know, because it's at staff's local level to hear that reinforced. And I think Jez, you used the term recognition, visible, routine and meaningful. So not waiting for employee of the month, etc., but it's those thank yous for going above and beyond, and obviously still being relatively new. You know, do we give the managers kind of the tools and the techniques, and you know, it's top down and bottom up, isn't it? That kind of team appreciating your fellow colleagues, your line manager, you're feeling appreciated with your line manager, and that culture piece. And I was really curious about the trust-wide listening exercise and how you make in colleagues' experience of being valued. And do we think there might be some work coming out of that to help managers normalise that, as you know, so that's part of every day, is saying thank you?
Michelle?
We haven't got all the information. We haven't, as an exec team, got all the information yet. Comms have been leading that because we want us to be quite independent. I know they're just rounding up the report, and that will come through, obviously, ODG, the Operations Delivery Group, executive team, but then up to the People's Committee as well. So, but apparently some quite interesting things coming out. But I can't give you that information, Kath, as yet, because it's just been collated. Well, and we've also done a gender paper as well, not a gender paper, sorry, an age paper for working practices in relationship and opinions of staff in different generation X and Y and all that sort of thing that confuses me at times. But that's quite interesting, so we'll feed that in as well.
Okay, thank you.
Thanks, Michelle. Can't see any other hands up. I just wanted to reflect on a couple of points you raised, Jez. I think the point about those everyday opportunities, just to say that was great. You did a really good job there. And feedback when there's maybe something that's been reported to a manager about some really great work from a patient or a family to all. I mean, I'm not saying it isn't done, but those things, I think you're absolutely right. You can have as many employee of the months as you like, and we've got that. Michelle and I every month look at those, don't we, Michelle? But actually, it can't just be almost like a top-down thing. It has to be bottom-up, and I think that does happen. But maybe there's other spaces because of pressure of work. But maybe with some of our managers about, you know, just saying, you know, there's lots of things we know you do, and there's a lot of pressure on you as, you know, frontline managers, supervisors. But actually, just that little human touch is really valued a lot and will help you probably with the bigger stuff that you might have to deal with the team as well going forward. It's a really big investment. I think I just wondered about your thoughts as well about meeting cultures as well and how they operate. And I'm not saying they're Humber, but I recently was reading, because I'm a bit of an anorak, some research done by, I think it was the London School of Economics, on meeting cultures in America and in the UK and elsewhere. And one stat stood out for me, which was in the UK, it's felt that 35% of work meetings aren't really productive, and the cost of the British economy. The cost of the British economy is something like 48 billion a year, which is more than the defence budget. Now, I just, again, in that report, there were examples of different ways of doing different types of meetings. So for a team meeting, one was ask everybody what they've been working on this week, just a bit of a highlight in a minute or two, what they're doing next week, but also asking the question, are there any obstacles we can help you with? You know, and that, I'm not saying that is probably too simple for the NHS, I'm sure, but I just sort of wonder about that, how we do that, because, you know, the NHS as a whole has a lot of meetings, and I do sometimes worry that, you know, are they working as well as they should be? Do people feel the benefit of the meetings they're going into? And we don't always have control over that when it's with partner organisations outside. And how they work in those meetings. But I do think about that, and think about, you know, how much time is taken up and how much comes out of it that people feel was worth turning up for. I'm not saying it's a big problem, but I think it's for an organised, and the NHS more widely, I think there's constantly more things being asked to do, constantly more policies. And I heard your point on policies as well. That can be a situation sometimes where the policy sort of almost overrides just, we've got it, anything else, and they can end up being quite long and deep and difficult to understand, particularly if you're a busy person out there actually working every day. So I'd just be interested if you've got any insights into those areas.
That's quite a question. I think everything's connected, especially with all of those, and it's difficult to find the way. It's that bit about we're all dead busy, and here's another meeting, and here's another meeting, and you know what's the content. I think that's really key. It's not just an NHS thing. I get to go on meetings that seem pretty pointless, and then you hear your name and you're like, you look up and you're like, what was said. I think that's the same, you know, so making sure that everything's relevant, making sure that they don't take up too much time, which actually puts a bit more importance on the role of whoever's meeting it is, that they have to be better prepared. They have to not have loads of waffle, and it's got to be, you know, something that they can ensure that it delivers something to everybody present. So whether that's because I've had a conversation with you and I've given you praise or given you feedback or given you help or pointed you in the right direction, or whether you're a member of staff who just happens to be in the meeting, wasn't really affected by it, but you know, suddenly realized that that would work for me, and I've got somewhere to go and I've got some help. And that, you know, it's you know, sometimes it's really easy just to put a 1 hour meeting in and then fill the agenda, you know. And you know, we'll have heard it, because I'm sure all of you have said it at some point, well, we can give you some of your day back, you know, which I think you know, too many of us say now, and it becomes a little bit glib, but actually, you know, it should almost be celebrated that we're not taking an hour just because it was an hour in the diary, and that we've covered everything and it's been really positive from word one to the end, but done it all in 50 minutes is a definite win. The other thing is, with policies, and it might sound a little bit uneven, but I think, you know, especially when you've got a broad reaching policy, what people really need to know and really need to have explained to them really quickly is what the overall policy is and how it affects you, because sometimes that's really not clear. So if you're able to say, this is the new policy, this is what it replaces, this is why we brought it in, and then, you know, if it's delivered broadly to everyone in the trust or by department, just explain how it actually impacts, what it really means, rather than, you can read more about it on the intranet, which then relies on people being interested enough to go and do it, and actually having the time to go and do it, and then, you know, interpreting it one way and then inevitably talking to their colleagues and not actually having the right information, or just sharing the bits that they weren't happy about, or all those questions like, yeah, but they didn't tell me how that matters for me. You know, so again, it's about transparency, but spoon feeding is a bit too simplistic a term, but, you know, actually being able to say, this is why it works for you. And one of the bits that predates that sharing is, wherever possible, having staff involved in that process. If you're going to make change, get them involved in it, particularly if it's something that's been mentioned in the results for a staff survey, and even more so if you've seen comments in the free text responses. You know, if they're actually pointing out something about whatever area, then getting them on board and getting them to help we you know, create something that works. You know, it's not always possible, and some of the decisions will be out of their hands, but, you know, the more on board they are, and the more it feels like they've had a hand in that process, the quicker it is for them to you know, take ownership of it, and to share it, for those who weren't on the working team, for them to share it with their other colleagues. You know, so it's that inclusivity and involvement that becomes really key, and seems to have had greater success with trusts that I've spoken to in the past.
Thank you. Okay, nobody else has got a question or comments. So thank you, Jez, for that presentation. We can mull over the slides a bit more when we receive them. Great. Thank you very much, Jez. Thank you.
Thanks, everyone. Cheers. Bye.
Okay, right. Moving on then to Residents Doctors 10-point plan. Kwame.
Thank you. This is just to give an oversight for board on the 10-point plan. I have presented it in different committees, but the key point here is that we are performing strongly against the 10-point plan. There are some remaining actions, but it's more about maturity and embedding rather than fundamental gaps. Therefore, the risks are low and manageable from the path that I've attached. We have a clear oversight of the 10-point plan. I have done presentation to OD committee, EMT, and also board. This is the second time I'm presenting to the board. In addition to that, I oversee it, and thanks, Phil. Phil has joined to the NED to oversee the 10-point plan. And we have resident doctors, as well as Dr. Quadro, who is our guardian of safe working, who oversees to make sure that. So the attached NHS feedback, NHS England feedback, as well as the Bath confirmation of the fact that we have a robust response to the 10-point plan. And I'm happy to take any question from board members about it.
Thanks, Kwame. Phil, did you want to add something as our NED residents doctors person. Thank you.
Sure, just to confirm that Kwame's involved me before this paper went to board. The NHS England think we've got a 96% completion rate, and that the most important thing is that our resident doctors seem content. And even where there are a bit of inconsistencies around sort of annual leave policy, we get very few complaints. I think just one thing we're working on is payroll errors. Obviously, the doctor's hours change quite a bit, so it must be quite complicated, but those sort of things do lead to frustration. But most importantly, our resident doctors seem very content with what we've done, and any outstanding things tend to be more around national issues and getting organised nationally. But yeah, so yeah, really content.
Thanks, Phil, for that. Thank you, Kwame. Any other questions or comments from colleagues?
Oh, just a confirmation.
Sorry, Kwame.
Just a confirmation that we haven't had any payroll errors, but it needs to go into the BAF to say that we don't have that. Just a confirmation. And Peter's kindly agreed that every time he does a report, he will put in that we haven't had I don't know how they've achieved it, but no payroll errors.
Thank you for that additional assurance on the call. And Pete, your team's on it as well. That's great. So we'll see that reflected in the BAF, yeah? Great, lovely. Good. Okay, thank you very much for that report, Kwame. Let's move on then to the fit and proper person compliance report. I'll take it as a read. We've gone through all the checks once against this year. I've gone through every single document that Stella has provided to me and opened up and checked against things for the whole board, and where I've need to speak to anybody, I've done that as well. So I'm very happy and content and been happy to authorise the sign off of some of that work. And so therefore this is for you to note. Any questions? Brilliant. Thank you very much indeed. So we'll move on now to the annual committee effectiveness in terms of reference review. And Stella, can you speak to this while I chair? Yes. Is that all right? Thank you.
Yeah, no, that's fine. So this is just to confirm that all the committees have completed an annual effectiveness review and a review of their terms of reference. This paper tries to summarise in one paper the outcomes of those reviews. All committees are operating effectively. There were some areas of future focus which will be included on work plans. So it's here for noting, but the terms of reference are here for approval, Chair.
Thank you very much, Stella. You've got the papers and you've got the in the body of the report the amendments to the terms of reference approvals for each committee. Any questions? No. Thank you for the work by the committees on all of this. Is the board happy to approve those changes? Thank you very much. Thank you, and thank you, Stella, for your work as well on this. Move on to item 18, which is the board effectiveness review. And hang on one sec, bear with me. Thank you very much. So hopefully it's all in the report and clear. I think generally the board has been working well. We've managed to keep to our schedules of having public boards, but those opportunities for strategic development board meetings as well. We had a good conversation, I think back in September now, on looking at some of the board paper issues. And I think there's been improvements there, but we'll keep an eye on that. I think sometimes some of the front sheets could be populated a bit more in the quadrant boxes rather than referencing the additional paperwork. But that's a very minor thing because most of them, I think, actually do that really, really well. We've had a few changes to the terms of reference, which are all included in the cover report. I'm happy to take any questions from board before I seek approval. Any questions? No? Board happy to approve that report? Thank you very much indeed. And now we move to the finance report. Pete.
Thanks, Caroline. So this is the finance report as of the end of April. As with previous April reports to the board, it's a light touch month, April, due to financial reporting of year end and also year end accruals that do impact on the month one position. That said, really pleased to say that we reported a position to NHS England that confirmed we were break even at the end of month one, so consistent with our plan, and that we expect to deliver a break even position to the end of the year, which is what we've been asked to do. Our agency spend at the end of month two was slightly above our agency ceiling, but only minor, but that's to reflect that our agency ceiling is a 30% reduction year on year, and we know some of our agency plans, particularly with the medics, will kick into the latter half of the year. Our cash position remains stable. We had £24.5 million in the bank at the end of the month, and our better payment practice code for April was really strong at 99%. So quite a positive finance position for the early part of the year. I will stop there and I'm happy to take any questions.
Thank you very much, Pete. Any questions or comments, Pete? Great. No surprises in the report. Okay, thank you very much. That's noted then, Pete. Move on to the performance report.
Lovely, thanks, Caroline. So again, a report for April, and as an exec, we have been working on the format of the performance report. We've always had good feedback on our performance report when we've done well-led reviews and internal audit, but as an exec, that doesn't mean we can't look to see how we can strengthen reporting up to the board. So hopefully you can see in the report, we've now tried to strengthen the narrative within the report by sectioning the report. So we've got what would seem appropriate to go to either operational delivery group or a subcommittee of the board, and thank my exec colleagues for providing some further narrative. And we saw this yesterday at EMT, and we did feel that it has strengthened the report. We will be looking to strengthen it further. Time just escaped us this month, so we're going to include a finance section on the report, and we've included in the body of the report those indicators we will be including. I guess to pull some highlights out for month one, and I'm conscious of time, but we can then move to questions. We're obviously now in segment one of the oversight framework, and we have seen really significant improvements in both the patient safety and the access to services domain. So, they became an area of focus when the NOF came out, and we have seen some really good progress there. So that's positive. We continue to see strong performance on mandatory training and clinical supervision within the report, and sickness continues to be an area of focus. We have seen a very minor increase in April, but that performance is consistent with the target that's been set in our operational plan and is significantly lower than it has been for the previous quarter. I don't know if others want to add in, or if we go straight to questions, Caroline, I'm happy to do either.
Let's go straight to questions. Phil?
Yeah, there's some really good stuff in this, Pete. I can't believe we've got consultant vacancies down at 5%. For context, they used to be at 30%. And that there's no community waiting, patients waiting over 52 weeks, which is a real achievement. And I'm pleased to see the percentage of urgent referrals seen by crisis in less than 24 hours has increased. We've still got, excluding ASD and ADHD, we've still got 19 patients waiting over 52 weeks. I'd just like to hear about what we're planning to do to get rid of those. I have some ongoing concerns with the waiting times in East Riding talking therapies. We've only got 91.5% completion rate at 18 weeks. Really, the completion rate for talking therapy should be at 6 weeks. And then the third thing is the out of area placement for older people. We'd sort of got that bottomed out, and it's sort of seems to be increasing. Yeah, thank you.
Thanks, Phil. Pete, or does anyone else want to deal with some of those questions? Lynn, I think. Okay, Lynn.
Yes, just can I come back, obviously, Phil, on the over 52 week wait position? There obviously is the detailed report that will be coming to the next quality committee that will also set much more narrative and obviously the plan to recover that position. There is a recovery plan. Those weights are specific to memory assessment service, Phil, which we have obviously discussed in the quality committee, where imaging and diagnosis are contributing to those weights delayed in there. We are still working on sort of alternative pathways around that, and particularly need to work with our ICB colleagues to do that. The other area which is recovering now is chronic fatigue, where it's a very small service and we've had an absence of a consultant in service. That has now been remedied. We have a new consultant, but the expectation is that that will recover really quickly. Just on the older people's out of area position, Phil, I think that goes back to what I was talking about earlier, that we've got delays in discharging service users. And obviously those delays, unfortunately, obviously mean that our capacity of our beds when we need them isn't available in the way that we would choose to. We have a plan around that. We are going to enhance, and we have funding to enhance the older people's out of hospital pathway as well, including the introduction of some step up, step down beds. We're just finalising that plan in terms of estate where we'll site those, but we are making progress with that. So our expectation with those plans is that we can eradicate that need for older people's out of area beds. The last group of service users, well, we don't want to put any service users out of area, but particularly older adults is not what we want to do. So, and we have obviously seen that continuing sustaining of the reduction, elimination actually of adult out of area placements, which is great, but we are focusing on those older adults and our PICU out of areas where I talked about earlier. So I hope that responds to those issues. On talking therapies, obviously there is, as you say, the 6-week compliant access requirement, Phil, which we are doing well with. It's the 18-week, obviously, which we are focused on. So we are looking at that right across the pathway at the moment, really analysing those referrals as well to make sure that we are working with the right patients through that referral process. Obviously, it does connect to our sort of community, broader mental health work as well. So that's part of that whole pathway position. There has been some short-term absence in that team as well. I'll pick that up when the detailed report goes to the quality committee as well. So we do have a dedicated recovery plan in place, and obviously we are working to eradicate that pressure on the 18-week access.
Okay, thanks, Lynn.
I think that was all your points.
Thanks for that full answer, Lynn. Thank you. Steph and then Kath.
Yeah, thanks for the report, and certainly the division of the report into sort of committee themes is really helpful to understand, and the analysis at the start of each one is really helpful. Just on this sort of governance issue here then, just to understand the governance flows here, do these reports routinely go to committee before they come here, or is it afterwards, or is it varied depending on the timing issues? I'm just thinking about where the level of the detailed scrutiny is coming in the process. So that's the sort of first area. And second area, I'm just struggling a little bit with the move to clock stops process and what that means, and looking at the charts in relation to that, because we do see some changes in the way that the information is presented, and maybe it's just something I need to get my head into. But is there a sort of simple explanation around that would just help our understanding?
Pete,
thank you.
Yeah,
thank you, Steph.
So the two questions, Steph, in terms of the timing, it would be varied. It would depend on the timing of the committee, wouldn't it, in terms of the production of the report? But from an assurance point of view, this report goes to ODG and EMT on a monthly basis. So there's a level of oversight there. And obviously, as the exec lead for each area, we would decide what we would need to make committee chairs aware of, or indeed take a separate deep dive into committee. On the clock stops, can I take that as an action, and I'll get a briefing that we can circulate around the board to give a bit more detail on it?
Yeah. Thank you. That's really helpful. If it has been to committee already, could we reflect that in the cover report and any issues that arose from that committee? That would be helpful. Thank you.
Thanks for those questions, Steph, and thanks for your answers, Pete. Kath.
Yeah, thanks very much, Chair. Just a couple of points. Steph's just picked one of those up. So what I was trying to do was, rightly so, Pete, you've redesigned the report, was trying to look where the data's telling us something's awry and it's starting to go out of the upper or lower control limit, and then read back to the ODG report to give me the assurance of how was that viewed and what's the action. And I think the clock stops was one of those that came out. It didn't really sit in that ODG review. So I'll be interested in on how that plays through. Just on your proposal around finance KPIs, I think that's really good practice, isn't it, to have finance sat as part of that balanced scorecard, which we're looking at. And I just popped a couple on your horizon to have a think about as well, because it is that snapshot of how we're doing financially, albeit that I know, you know, the finance committee goes through it in more detail. So I did wonder if you might want to consider whether capital versus plan delivery might be something we wanted to just have that KPI of, and maybe SIP delivery. But obviously I'll leave those with you to have a think about. I don't need an answer now. And then just right at the start of the report, probably not for you, Pete, when we're talking about quality and safety, I think Whitby's kind of highlighted in several different areas for me, on the sickness absence, on the clinical supervision, on the red flags. So I was just trying to get a bit more of a sense really on our plans going forward for that, and how concerned ODG and EMT and the actions that are in play for Whitby in particular.
Thank you, Kath. Lynn?
Yeah, I just
sorry,
wanted
Sarah, who's going to, shall I take, sorry, Sarah, did you want to answer that question?
I wasn't going to pick up Whitby, so I think Sarah's probably, but I was going to come back on clock stops.
Perfect.
Caroline,
So let's
that's
start with
okay.
the clocks and then we'll go to Whitby. Thank you.
I think there is a broader question that's been asked, and I think Pete's response to that is great. I just wanted to pick out the 104-week wait for children and young people, because that looks really concerning on face value. I just want to assure the board that we don't have children and young people waiting 104 weeks to access treatment. In fact, we've been 18-week compliant with our CAMHS community service now since February, and I think that's really important to understand, and I think we're quite an outlier actually in having achieved that. What stops the clock for 104-week waits is when we record an outcome measure on the electronic patient record. It's a new measure. We will achieve it and we're working towards that, but obviously we do complete outcome measures, but they aren't routinely by clinicians being added to the electronic patient record, and that's what will stop that clock. So I just wanted to give that assurance on that particular wait, Caroline.
Yeah, no,
Thank you.
that's fine. Can we just take away to think about how we can just reinforce that in the report so people have a context of that somewhere?
Yeah.
Because there's so many variants going on here.
There's a lot. That's just
it's really
applied
hard
to that
sometimes
one.
to get
Yeah.
your head around
It does.
some of this. But yeah, thank you. Sarah.
Yeah, so thanks, Kath, in relationship to Whitby. So the reason that they've triggered particularly on a number of indicators is one, they didn't submit the clinical supervision data in time. So the way that we capture the data isn't about that there's not been clinical supervision. It has to be recorded within a set window. And I know by April's data, we've had a submission of that. The other areas where the triggering is also in relationship to sort of basic life support and intermediate life support. And that's something that we've raised at a trust level. So our trainers were unfortunately those that were caught up in some of the worldwide disruption and were sort of caught up in another country, which affected our overall sort of data. So we've had a bit of a recovery plan, and what you can see in the report, in the narrative, is we've got a recovery plan to get back on track in relationship to our basic life support and our ILS by the end of June. And I know that sort of plan is on track. The actual staffing elements of that, we've just had our latest lot of safer staffing reviews, and they'll come through to board as usual. But there is a bit more work that Whitby need to do into making sure that their rosters, so when they're pulling in maybe more senior members of staff, that they're going on to the rosters, because that will automatically lift their fill rate as well. So I know for April's data that Whitby's in a lot better position. There's nothing in there that I'm sort of particularly concerned about in relationship to Whitby. Obviously, it is one of the areas where we have done a mock inspection. So, you know, there has been some concerns probably going back sort of 12 months ago, but they've got quite a robust sort of improvement plan, and we regularly receive updates in relationship to that through QPAS, and also it is featured into the Quality Insight report for Quality Committee. And a lot of their issues have been around recruitment and retention, and then some ongoing sort of culture and leadership development work. But all that plan is on track and is progressing well.
And are we
Thanks.
able to offer that support to deliver that plan from whatever corporate areas are, like you say, leadership, OD, etc.?
Yeah, we've got a robust sort of plan in place, which brings in sort of my team, Karen, Vicky's team, Lynn's team, and obviously Whitby is one of the areas where we have a really focused view on when we do our patient care and accountability reviews as well.
Okay, that's helpful. Thanks, Sarah.
Thanks very much, Sarah. And presumably, I mean, that's really obviously helpful to know that what's in place. Have you got a sense of where you want to be in 3 months, 6 months, with all that input that's going in and understanding of what some of the issues are?
Yeah, so what we are doing with a lot of the areas where we have done some mock inspections, when we're sort of expecting some of that work to be, let's say, becoming more embedded, we're now in the process of doing re-inspections as well. So Whitby is in the forward plan, and without saying the dates, is in the forward plan for the next few months.
Okay, thank you very much. Great. Okay, thank you. So I can't see any other hands up. I think the introduction of this device, segmenting it, and some comment is really helpful as well. But I noticed that obviously that the EMTs you're looking at the format future reports, and there may be some changes. Maybe it would be helpful for non-executive directors, maybe at one of our next catch-up meetings, just to have a chance to sort of, if there anything else we might like to help to contribute to that from our perspective, to pull some ideas together. And so I'll have a think about that. And the other thing, just for Andy and Carrie, as part of your induction, if you'd like to have a bit more briefing from colleagues who sort of, if you like, lead on this report, I'm sure that can be provided as well, particularly if you're not used to this. Carrie, you may have a sort of professional background that's sort of used to this, but might want to refresh. And Andy, it can be quite overwhelming seeing all these charts coming at you. So I'm sure we can accommodate that if it hasn't been done already. Brilliant. Okay, thank you very much. And thank you for those questions as well. We'll move on to the next item, she said, looking for her, hang on a second. There it is. Thank you very much. And we are on to the risk register update. Oh, no, we're not. I think. Hang on a second. Yes. Oh, that's moved earlier. Review of standing orders. Sorry. Thank you. Is that right?
I think.
Oh, you're
doing. We are on the risk register.
No, it is you, Sarah, isn't it?
Yeah, apologies.
Sorry, I got that mixed up with earlier on. Sorry.
It's okay. Thank you, Chair. I wasn't too sure whether Oliver was drawing in, but if not, I can proceed to present, so that's fine. So you've got the risk register update. Obviously, the board regularly receives the risk register for those risks that are of 15 and above. And those are detailed within the report. And then also there's an update there in relationship to obviously the discussion when EMT did the review. So EMT were assured that there was the appropriate actions in place. And obviously one of the things that Oliver alluded to earlier is that EMT have also requested that ODG regularly review those older risks that are 2 years and above, and then also those where there've been no movements in the risk rating for a period of 6 months as well. So there's currently 4 risks on the risk register that are 15 and above, but happy to take any questions or comments.
Thank you, Sarah. Sorry for my confusion there, because we had risk earlier on as well. So sorry about that, everybody. Any questions or comments? No? Thank you for that. I like all the pie charts and graphics. That's all very nice, good to look at and informative as well. Okay, thank you very much. So we'll move on now to the report on the use of the trust seal. Oh no, changes to standing orders. Sorry, scheme of delegation. Stella.
Hi, thank you, Chair. So this is the annual review of the standing orders, scheme of delegation and standing financial instructions. It's been reviewed by a number of teams that contribute to that document, and a number of proposed changes are contained or detailed within the paper. These relate to sort of like the procurement, financial limits, and changes to reflect current practice in other areas. It's been to Audit Committee for review, and they've supported the changes, and it's here for approval before publication on the website.
Thank you very much, Stella. Are there any questions to Stella? This is something we have to approve today. Everyone happy with the proposals? Okay, is the board happy to approve the recommendations in the paper? Thank you very much. And now we are on the use of the trust seal. Michelle.
Yes, apologies. Turning the camera off for a couple of minutes because my broadband's not very good. So I hope you can hear me okay. Yes, obviously this is an annual report, just to clarify with the board that we do hold the trust seal that we use obviously as required from a legal point of view, and just to say that the trust seal has been used 6 times this year under, as I say, the strict guidance of our policy and procedures. So it's signed by myself and the director and the trust secretary, and they're there just to say where those seals took place. Thanks, Chair.
Thanks very much, Michelle. Any questions, Michelle? This is for noting. Thank you very much, Michelle. We now move on. Compliance with the new provider licence. Stella.
Yeah, thank you, Chair. Again, this is the annual review, which outlines how we comply with our provider licence. It comes to the board each year, and it's reviewed and updated by EMT colleagues prior to it coming to board. Those updates are highlighted through track changes or strike through, or read within the document. It's here for assurance purposes. It will also go to the Council of Governors for information as well.
Thank you very much. Stella, are there any questions or comments on this report, which is for discussing? No? Okay, thank you very much. That will therefore go to Council of Governors for information. And we move on to 25, review of Constitution. Stella.
Yeah, again, this is the annual review of the Constitution. This year, we aren't proposing any changes. We have changed it quite a bit in recent years, but this year there are no proposed changes. The Council of Governors has received the same paper because if there were any changes, the Council of Governors and Trust Board would need to approve them, and the Council of Governors didn't highlight any areas for change either. So it's here for the board to note and agree that no further changes are required.
Thank you very much, Stella. I can't see any hands up, so that is noted by the board. Thank you very much. So we'll move on now to the Assurance Committee reports. And Keith, you're up first with Finance Committee.
Thank you very much, Caroline. I think I'm conscious of time and stuff, so I think I might say, because this was a meeting on the 21st of April, the finance element of it feels a little bit dated now, given how much we've moved on in the reports. But I'll take as read. I think overall we're working through this new system that we've been using in terms of splitting the assurance meeting up. We were very assured, fully assured on section 1, which is all around grip control and financial performance. We were mainly assured around some of the areas in section 2, which is productivity and efficiency. I think we've moved on hugely in the information we're looking at. Pete and I have had a couple of offline conversations as to how we think we can improve that and continue to improve the efficiency and productivity. And I think full assurance will come with that in a period of time. And then we're fully assured in the sections around digital, BAF and other matters that come into section 3. Other than that, there's nothing specific to escalate. Caroline, I'm happy to take any questions.
Thank you, Keith. Are there any questions to Keith? No, okay, thank you for that detailed report. And we move on to People and Organisational Development Committee Assurance Report.
Oh, let me just unmute myself. Thank you for that, Caroline. So I'll take it as read the report. It provides strong assurance that the Trust's performing effectively across the range of workforce management and OD staff wellbeing, equality, education markers, strong workforce performance, proactive around staff, positive staff experience, and really good preparation for some of the future workforce and legislative changes that are heading our way. I think the main strengths, staff wellbeing and engagement remains strong, high uptake of wellbeing services and targeting support where we've still got higher levels of sickness absence, demonstrating mature and inclusive organisational culture. And I think that's backed up by the staff survey results, which I won't go into because we've obviously had quite a detailed presentation on those today. Active staff networks and progress against the national equality standards. So the workforce metrics remaining positive includes the high mandatory training compliance, low vacancy and turnover, strong appraisal completion, although some issues around the quality there, improving sickness and absence levels, and successful leadership around the apprenticeship programmes. Some areas that we still need continued focus on. Improving appraisal quality, which I've just touched on, ensuring staff feel valued, reducing burnout and the MSK musculoskeletal issues where we can, and strengthening people's confidence to speak up. Future readiness and looking ahead. The report also confirms good progress in preparing for future organisational requirements, including the planning for the Employment Rights Act, and the delivery of the 26-27 training plan, participation in the National Transforming People Services Programme, and continued strong performance against national productivity and oversight benchmarks. Recruitment and retention, we've heard from Kwame earlier about the medical workforce, and that's improved significantly, including the reduced consultant vacancies, which again we've touched on, and the lower reliance on agency. Still some specialist recruitment challenges remain. So I think that probably sums it up. Maintaining strong workforce performance, strengthening equality, inclusion and wellbeing, and it just suggests a well-governed organisation really, with clear improvement plans in place. Happy to take any questions.
Thank you, Kerry. And that was your first meeting, wasn't it? Chairing that meeting.
It was.
So I hope you got all the support you needed for it as well.
Everyone was very kind.
Great, thank you. I can't see any hands up, so we'll thank you for that. We'll move on to Phil, Quality Committee.
Yeah, this is a meeting that we had on the 8th of April. We're continuing increased focus on outcomes, triangulating data and information, and making sure that we've got strong patient perspectives in all the areas we look at. So we had a paper on clinical outcomes report. We looked at the triangulation of patient-reported outcome measures and clinician-reported outcome measures, and see how they match. So that was really good. We had a report on safer staffing, and we looked at how we make that realistic and how it gets tweaked to reflect peak demand, so it's not just a statistical average. And we also had a look at the multi-professional strategy, and we brought that back to NEDS, and there's some more work to be done on that. But yeah, as always, lots of stuff in a clinical inequality committee, but really giving good assurance that the Trust is providing safe, effective services to our patients.
Thank you, Phil. Any questions to Phil? Okay, thank you for that, Phil. Moving on then to Audit Committee, Kath.
Thanks, Chair. Just to pull out a couple of issues that were reported. So really good positive assurance on some audits, and it only gets 3 lines in the Chair's report, but the amount of work that's gone into that, for particularly the significant assurance for the Bath and risk management audit, which I know Board have already seen. There was an audit on succession planning, loan working, clinical stock management and efficiency, and the medical examiner role, and they were all significant assurance. And given the the diverse range of subject matters in there, to gain significant assurance in all those areas was really positively welcomed by the committee. Also, the draft head of internal audit opinion is likely to be significant assurance, albeit there is 2 audits left to deliver in the plan, and they may not be quite as positive assurance, but the internal audit seemed content that that wouldn't impact on our year-end statement, and the audit committee will receive those at its June committee. And then finally, just to know, obviously we're into year-end processes really, so the auditors are currently in with Pete's team doing their work on financial due diligence, and they were reporting that back to our June audit committee, which will be there to receive the annual reports and the annual accounts and all the year-end statements that go with that. So that's it from me, Chair. Thanks.
Thank you very much for that, Kath. Any comments? It's all very clear. Thank you very much. Steph, mental health legislation.
Thanks, Chair. Yeah, this was a meeting on the 7th of May. We received the usual assurances in relation to Mental Health Act, Mental Capacity Act and restricted interventions. Nothing major to report there. We had an interesting report on mental health inequalities and the Mental Health Act, which was very helpful and useful. And also in terms of national issues, we continue to keep an eye on what's happening with the new Mental Health Act. And we looked in detail at the Trust response to CQC monitoring Mental Health Act report for last year. I'll leave it there. Thank you.
Thank you very much, Steph. Any questions for Steph? No? Okay. Thank you very much, Steph. We'll move on then to the next item on the agenda, which is just for noting, which is the July Board Strategic Development Meeting agenda. We've shifted it slightly to the beginning of July this time. So thanks for everyone's cooperation with that. Anything on that? No. Move to item 32. I haven't received any items to escalate. And this is just to ask really, because obviously at the top of the meeting, we've moved up as we agreed the board assurance framework to higher up the agenda. Has anything on the agenda contributed to or improved the board assurance framework position? I think there are a couple of things that came up in other discussions that will be reflected back into the BAS, so we'll definitely pick those up in the minutes. Is there anything else anyone would like to add at this point to that? No? Okay, thank you. No any other urgent business. Reviewing of the meeting, any comments under the subheadings that are on the agenda? Thank you for your patience. So we had a lot to discuss. Anything to take away? No? Okay, thank you very much. That is the end of today's public board. Thank you for everybody who's presented. Thank you for the reports, and thank you for the discussion questions from colleagues on the board. And for anybody watching, we hope you enjoyed it, and we'll come again. Thank you.